But first, let me now turn to Shaniqua Owusu and Becky Johnson from Change Lab Solutions.
Hello, everyone. We are so excited to be here talking to you about the workforce. And I will say we take a very holistic approach to the workforce. For more than 25 years, Change Lab Solutions has worked to build the capacity of the public health workforce to create healthier communities for all through equitable laws and policies. In our work, we define the public health workforce very broadly, including many professions that do not have health in their title. These partners include all government agencies and policymakers at local, state, and federal levels, including all 3,000 health departments. It also includes entities like community-based organizations, healthcare, academia, just to name a few. Today, we're going to focus our comments around the following topics. We're going to give a little bit of context setting, which some of my colleagues have already done, so we'll do a slightly shorter version of that. Then we're going to talk about workforce capacity needs around law and policy. Then we're going to talk about workforce structural needs. And then we're going to talk about how we center community in all of this. We need a workforce who can support communities in driving law and policy change to advance health equity. Yet, practitioners are at varying levels of readiness and ability to do this. As described by my esteemed colleagues, public health is at an inflection point where we are trying to navigate how best to serve our communities in the face of real challenges like rollbacks in public health authority and mistrust, among others. Any recommendation that aims to support the workforce needs to provide strategies for navigating these challenges. This means looking both at laws and policies that drive the composition of the workforce, as well as the capacity of practitioners to work on these issues. And we need to support the workforce across their entire career, both within government and outside of government. So let's start by talking about their capacity needs. No matter where a public health practitioner sits, they need to have at least a basic understanding of law and policy. For example, whether a public health professional is researching asthma data, working on tobacco control, or on school wellness, it is important to understand how laws, both past and present, have contributed to multi-generational harm. If we don't, then we may select interventions that are best ineffective or at worst actually harmful. For example, an asthma researcher might note that Black communities have higher rates of asthma because of genetic differences, which reinforces abhorrent, long refuted, and disproven theories about biological race, instead of focusing on our country's legacy of structural racism in housing. In order to do this work, we need to support practitioners no matter their educational pathway into public health. To start with one pathway, we at Change Lab Solutions looked at 190 schools offering MPH programs, MPH degrees. Only 13 schools required students to take any course dedicated to law before graduation, and only three schools required a dedicated course on public health law for all students before graduation. Additionally, it's not just enough to train the future public health workforce about the law. We need to build their skills in areas like community engagement and advocacy. A recent Health Affairs Journal article reported that of the 68 accredited schools of public health in the US, not one requires an advocacy course to graduate with an MPH. In addition to supporting the workforce as they go through educational pathways, we also need to support the workforce once they are in the field. We have at Change Lab a library of resources to help the workforce. I put 4 here that we think will be most relevant to the conversation today, and I suggest you check those out in your after today's meeting. In addition to supporting the workforce and capacity needs, we also need to look at the structural policies that affect the workforce. In order to advance health equity, we need to do the work internally by working on equity, diversity, and inclusion in the public health workforce. There is a strong interest to work on health equity. However, applying an equity mindset that centers racial equity is newer for many, which can be attributed in part due to staffing patterns. For example, in the 2019 Nature profile, it found that over 90% of local health departments and top executives were white. Recognizing the need to address power and privilege in public health, health departments are taking action. For example, the New York City Department of Health and Mental Hygiene launched Race to Justice, a multifaceted effort to advance racial equity and social justice across all programs, policies, and practices. In addition to EDI policies, we've identified 7 areas of policies that can support the field. And this list is far from exhaustive, so we encourage you to flag other areas in the Q&A. First, we need governmental budgets that provide flexible, sufficient, long-term investment in public health. We recognize that there's a lot of federal funding aimed at addressing this gap, and we need to ensure that funding provides a long-term investment in our workforce. And as we make these investments, we need policies that equitably pay public health practitioners. Before the pandemic, some of the largest barriers to recruitment and the biggest contributors to staff turnover were low wages and salaries. We ask a lot of our public health workforce. We need to pay them accordingly. We also need to have conversations about how we pay different roles within public health. For example, community health workers play a critical role in our public health system. They should also be paid accordingly. In addition, we need policies that support the health, mental health, and well-being of the public health workforce. CDC reported that 1 in 5 public health workers reported that their employer did not allow them to take time off. We need to ensure our workforce, especially during times like these, have the space to step away to recharge. We also need policies that protect the workforce from harassment. 12% of the public health workforce has been threatened on the job. We, of course, support public discourse, but threats of violence should not be tolerated. Some states, like Colorado, have passed laws to address these issues. We need policies that support hiring a representative workforce, that make it easier to hire people who've been involved in the criminal legal system. We also need policies that support hiring professionals with specific law and policy expertise, such as attorneys, policy experts, and people with skills in community engagement and grassroots advocacy. We also need to think about licensing requirements. We want to ensure the health and safety of the public while ensuring the accessibility of critically needed public health services. For example, a 2016 study found that half of US children with a treatable mental health disorder did not receive needed treatment from a mental health professional. Certain states' laws and policies governing children's mental health care providers are largely implemented by the state level. Certain states' approaches may foster a more favorable context for growing the behavioral health workforce, while others may narrow that pathway. We need to understand this landscape in this space, as well as other areas where credentialing is required, as well as licensing. Now I'm going to hand it over to Shaniqua to talk about centering community and the role of community-based organizations.
Thank you, Becky. So I want to start by circling back to equity for a moment. A key component within public health practice and advancing health equity is community engagement. It is critical that equity principles guide such engagements so that they benefit community and are respectful of its agency versus being extractive. A key partner in this are community-based organizations, which I'm going to spend a little bit of time talking about. They're a critical part of the public health ecosystem and is indispensable within the wider public infrastructure. Often underfunded, they should be empowered and funded in accordance with the vital services and supports that they provide. So as you can see, they are a significant segment of the public health workforce. CBOs leverage partnerships to extend their reach and impact. Often facing those limited resources, as I mentioned, they tend to leverage partnerships with each other and often with local and state governments. They serve as an important link between government and community. They act as a voice for their communities and assist government and other institutions with the delivery of critical services. And due to their strong relationships with communities, CBOs are well suited to reach out to underserved and hard to reach populations. They can also quickly pivot from their usual service to address emergency needs that may arise. And CBOs can help connect residents with engagement opportunities. And so I think we really saw this live and well during the pandemic. CBOs demonstrated their critical role throughout this time. They assessed gaps in local and state responses to COVID-19 and used their flexibility to meet community needs. CBOs distributed funds, materials, and resources to families to help them avoid evictions, afford basic necessities, and minimize negative health outcomes. Their close relationships with these communities made them a trusted source of information, allowing them to help communities better understand the pandemic and public health regulations, and which helps to also aid in compliance in some of those regulations. And then just to ground this for us today, I am going to share what occurred on the ground here in California. During the pandemic, CBOs used a person-centered strategy to address residents' immediate needs. So I want to just pinpoint that that is an equity forward principle. Community-based organizations put people in the forefront, using community-defined practices and person-centered strategies, providing culturally and linguistically competent services. CBOs tend to employ from the community. They have high rates of success in working with community residents, building trust, helping people navigate services. And for example, during the pandemic here, community organizations used community health workers to help meet the needs of their communities. Also, trauma-informed approaches were uplifted. At the time when low-income Californians were experiencing multiple levels of hardship, many expressed trauma and fatigue from navigating complex, unresponsive government programs and systems. As such, CBOs help to ease these burdens by using a trauma-informed approach to delivering services. This approach acknowledged community members' humanity and ensured that they were not burdened with multiple applications or unnecessary travel. So for example, CBOs partnered with service providers to deliver food and hygiene care packages while disseminating public health and other educational materials. Another key principle is meeting people where they are. During the pandemic, many people were unable to access public transportation or chose to forego it due to safety concerns. As a result, some were immediately cut off from basic resources, appointments, and social connections. And so CBOs keep folks socially connected and engaged. And in the time of crisis and uncertainty, it was crucial for residents to have a trusted source that they could provide timely information and counteract misinformation rather, as well as feel connected to a larger community. So here in California, we saw the utilization of social media platforms and other tools that folks in said communities were using. And so with that, we'll come to a close and pass it on to our other panelists. Thank you very much for your time today.
Thank you so much, Becky and Shaniqua, and really appreciate you both calling out how important the role of community-based organizations have been. And I would echo that in our discussion. Maybe we can share a little bit about how the foundation's been supporting community-based organizations for all of the reasons that you point out.